Hi, this is Dr. Nicole Hemkes with Advocate MD Direct Primary Care. I wanted to post another video and thank you for those of you that watched the first video that gave you some information about our practice. But today I wanted to talk a little bit about what direct primary care is because I've gotten a lot of questions about that. So, direct primary care is a newer model of healthcare, and I wouldn't be surprised if you have not heard of it, but in some parts of the country, this has become very popular, and there are many of these practices that have been around for years, and then many of them that are starting up in the last, year or so. So, what this model of healthcare is that the patient and the physician contract directly with each other. So we eliminate the middlemen, which in this case would be insurance companies and healthcare administrators, large healthcare systems. So most of these practices, the majority of them, are started by a single physician, and the physician owns the practice. They are not owned by a larger healthcare system. They're not franchises. They're directly solo owned practices, and that's what my practice is. I own the practice. We're not part of any larger health system. I am the only physician currently. So the way direct primary care works is that because we are able to contract between the patient and the physician, we are able to eliminate up to 50% of our overhead expenses. So what's happened through the years, unfortunately, a combination of insurance and just health systems getting larger and larger, that we have to employ now coders and billers and have expensive electronic medical records to keep up with all the requirements from Medicare and all these different insurance companies. So what that's done is increase the cost of all of these things and increase the overhead for primary care doctors. What it's also done is, because the costs have gone up, then in many cases, health systems, say to the primary care doctor, well, now you need to see 25 patients. Now you need to see 30 patients. So those visits get shorter and shorter and shorter. And so it's become a very unsatisfying thing for both the physician and the patient, because I would like to feel like I can sit down and talk to my patients and hear everything that they need to talk to me about and not feel rushed and not feel like I'm rushing them through the visit. But unfortunately, that's kind of the way I felt in a traditional insurance fee-for-service system. So I found direct primary care. And even myself, when I first heard about it, I was skeptical. I thought, this sounds too good to be true. You charge the patient a monthly membership fee, and the fee seems pretty affordable. And then you cover all office visits. If you need to have phone consultations, if you need to email or talk to me after hours, in the evenings, on the weekends, all of that is covered. If you need to have minor procedures, a mole removed, and a joint injection in the office, all of that is covered as part of your monthly membership fee. And what is different about this and then a normal cash doctor is that a cash doctor might charge you, go in and see him for a visit, and it's $200 or $100 every time you go in and see them. So in our model, you pay the monthly membership fee. There's no limitation on how few or how many visits that you have. There might be a month where you're very healthy that you might not need to come in and see me. There might be another month where twice in the month you have to come in and see me, and you have to call me on the phone a lot. That's okay. That's all part of this direct primary care model. And the great thing about it is that it doesn't disincentivize people from, when they are sick, coming to the doctor when they need to be seen. What happens in the traditional insurance fee-for-service model is that if you have a sore throat, if you have a bad cold, maybe you don't want to pay the $40 or $50 copay. Maybe you've got a high deductible, and you know that if you go into the office visit, it's going to be a $200 charge. If they do labs, it might be $300 or $400. So what people do in a lot of cases, that they don't come into the doctor when they need to be seen. So what happens? In some cases, they become sicker. And then they might get to the point where it's been going on for a week or 2 weeks, and then they get sick enough to where they unfortunately have to go into an emergency department or an urgent care. So we would like to prevent all of that, because again, that just is going to increase healthcare expenses for you, and that's also not good for you. So in our system, when you're sick, you're going to be seen. You're going to be seen the same day. We will, if you call us and you're sick, then you will be seen by me that day. There's no, see you tomorrow, see you next week, we're booked up. That doesn't happen in this model. So how are we able to do that? Well, we keep our patient panel much smaller than a traditional primary care doctor. So a traditional primary care doctor has, on average, maybe 2,500 patients in their entire panel, and our panel will have about 600 patients when we are full. So what that allows us to do is to spend longer with the patient, to give them the time that they need to call, to answer their phone calls if they call after hours. That allows us to fit them in the same day when they're sick. So all of these things are very beneficial to the patient, and they're also very beneficial to me because I want to feel like I'm helping my patients and that I can spend the time that they want and that I can practice the full scope of what I was trained to practice, because I can do procedures in the office and I have the time to do that. And I can see patients, after hours if they have something urgent going on. I just have them come into the clinic rather than tell them to go to an urgent care and emergency department. And I get that this, again, might sound too good to be true. So for people that are unfamiliar with direct primary care, which is most of us, I would definitely encourage you to go to a website called DPCFrontier.com. And on there is a map of all the direct primary care practices across the country. There are over 900 of them, probably at this point close to 1,000. Again, all over the country, but more highly concentrated in certain areas. And you can go to all of their websites, and many of us are very similar. The basic things are that we charge a monthly membership fee, that all of our costs are kept very transparent. Everything is advertised on the website. We don't bill anything, behind your back or add on anything if you need a medication. All of that cost would be upfront. And the other great thing about direct primary care is that we can dispense medications from the office, and we can save people a lot of money on their medications. We get medications at wholesale prices. We also can get labs at wholesale prices. We can draw your blood here in the clinic. We send it to the lab to be processed. And again, we can save a lot of money on the labs, on the medications. And if you need an x-ray, if you need an ultrasound, we have cash pricing for all of that. So really, it's a different model of healthcare, and it's a much more higher quality that we can attain when we are able to spend time with the patient, talk to the patient, be available to them after hours, be available, to talk to them if something is going on. And that continuity of having the same physician every single time, even if whether it's during the day, at night, on the weekend, it would be me that you're calling and talking to. So with that continuity of care, with the accessibility of the physician, with the length of time that we can spend in appointments, the overall quality of care is greatly, surpassed of anything that we can do in a fee-for-service system, unfortunately. And then the cost is much lower, again, because we keep our overhead lower. And then we can also pass on the cost savings of the wholesale medications, the wholesale labs, and the discounted prices on x-rays and ultrasounds and imaging. So I would encourage you to go to our website, advocatedpc.com. Our email address is on there. Our phone number is on there. We opened January 1st, 2019, so only in a few days. Our office is in Middleton, 3205 Glacier Ridge Road in Middleton, Wisconsin. We encourage you to call us, email us. If you want to come in to just meet me, I am happy to do that. And we really think that once you see what we're doing and how great this model is, that people will really catch on to this. And we are looking forward to this practice taking off in Middleton, Wisconsin. Thank you so much. Hope to hear from you soon.